There have now been more than 7.3 million cases on the African continent, and 184,000 people sadly have lost their lives. After several weeks of steep increases, we're now starting to see a leveling off of the third wave on the continent taken as a whole. However, the situation remains very fragile. More countries are reporting variants of concern, with the Alpha now in 44 African countries, Beta in 39, Delta in 30, and the Gamma in 4 countries. Vaccine coverage, unfortunately, remains low, with only 2% of Africans being fully vaccinated against COVID-19. But there's hope as vaccine shipments pick up pace, with the COVAX facility delivering almost 10 million doses to Africa so far in August. That's 9 times what was delivered in the same period in July. Yet, just as our efforts seem to be taking off, Africa is encountering headwinds. Moves by some countries globally to introduce booster shots threaten the promise of a brighter tomorrow for Africa. As some richer countries hoard vaccines, they make a mockery, frankly, of vaccine equity. High-income countries have already, on average, administered more than 103 doses per 100 people, whereas in Africa, that number stands at 6. Failure to vaccinate the most at-risk groups in all countries will result in needless deaths. We say this every week, and it cannot be repeated enough. It will also contribute to conditions where the virus will very likely mutate further and could ultimately delay the global recovery from this pandemic. We are hopeful that COVAX shipments will keep ramping up to reach 20% of Africa's population by the end of this year. And coupled with deliveries from the African Union and bilateral deals, WHO's hope for target of vaccinating 30% of people by the end of the year is still within our reach.